All right, so good morning, everybody. We're going to talk about the new tests here. So the way you're going to get to the new tests are you're going to go to your agent portal, and you'll see that we have our coverage verification tab. That's normal. One change is this is at 65 to 79.5, as we discussed prior, unless the person is on Medicare and they're disabled. So we had one yesterday that was 40 years old on Medicare disability, and they will qualify for these tests. This is the same. The PGX application is the same as it was before. Again, some qualifying factors. And we went through this form before. All right, mute your microphone, please. So then you're going to go to the agent portal, and here's the PGX form like we showed the last training. Again, you're going to fill out all of the yellow and ask all the questions. Okay. We're not going to go through these other forms. The CGX is the same as it was last time. The PGX CGX combo application is the same as it was last time. But here we go. Now's the time to look at the new application for the cardio. Very similar. Again, you're going to type in everything here that's required. And the insurance name, of course, will be Medicare. Insurance ID is the same. Administered by, again, remember when these happen, you'll print your name in here. Use all capital letters, please, and then put your agent ID number over here. So let's talk about the qualifications for the cardio test. Don't worry about this form here because this will self-populate once you type in everything that's up here. Just double check to make sure it's there, though. Qualifications for the cardio test. Either personal use of a heart or blood medicine, like blood pressure pills, cholesterol, that kind of thing, or a family member that has used or is using a blood pressure, heart medicine, or cholesterol. You'll ask these questions, though, for the personal history. Again, you'll see these are yellow. You'll still have to answer a few things and fill out this form here. Nothing's different. You'll drag and drop the photo of the driver's license or state-issued ID and the Medicare card front and back as normal. So yes, if you're doing a combo, you will have to upload the photos again. And it will also need a new swab. So remember, the white swabs are for PGX only. The blue or purple swabs are for all of the tests. So if you're out of white swabs, you can use the normal blue or purple swabs for all of these tests. And that's it. Pretty simple. One place for them to sign there. That's it. That is the new cardio test. Again, anybody that has a personal use of those blood pressure meds, cholesterol, that kind of thing, or a family history. So what I'm saying here is they don't even have to be taking a cardio pill to qualify for this test, which is exciting. So if you're sitting with somebody and all they qualified for was a cancer, you can ask them if they have a family history of use of blood pressure medicine, and pretty much everyone does. Alzheimer's, Parkinson's, dementia application. Again, looks very similar. Now, this is important. If they have a personal history of Parkinson's, they'll qualify for this test. That's the only personal history that they will be able to qualify for this test for. Family history, though, of either Parkinson's, Alzheimer's, or dementia. A family history of those or a personal history of Parkinson's. You just go through the form, making sure you get all the yellow and asterisk ones. And again, they sign. And you'll notice there's nothing for you to do on this form. And yes, you'll upload the ID and insurance card again. This will be for the Medicaid states only, the Beacon Carrier test application. Qualifications for this test are females between the ages of 18 and 35. They could have been pregnant in the past, pregnant now, or are of that age range contemplating pregnancy. Again, simple forms now. Not a lot to do. Again, ID, front and back of the insurance card. So those are the 3 tests, and we'll come back to questions about those 3 tests here in a little bit if you have them. But for now, I want to switch gears and talk about the retail test panels. This here kind of lists the qualifications for this test if people are cruising the website. Now we're going to go right through these real quick. There's lots of information about nutrigenomic testing, and there's been a lot of people saying, well, what are they seeing when they get the reports? I'm going to bring up a sample report for a PGX here in just a few minutes. But for now, what I want to do is just make everyone understand that you don't have to know everything about these tests to recommend them or suggest them to people. These are the triggers for these tests. So let's talk about this foundation one real quick here. These are the qualifications, or these are the things that people should be dealing with to want to order this test. And again, we're all adults. We can all read these things. So you don't need to know everything about these tests. Just know that if they have these symptoms or these conditions, these will be the tests that you will recommend for them to order. You'll also notice there's some overlapping. So pick the one, or let them pick the one that best describes their situation. Okay? And then we have the cannabis test. We'll talk about that here in a few minutes as well, and I'll show you a sample report there. All right. So let me bring over a sample of the PGX test here, results. All right. I'm going to show you the reason why we don't show people these sample test results here. Because they're either going to overwhelm them or underwhelm them. So this is what they're going to get. They're going to get a list that's got their current meds on it that they provided. It's going to give them color coding flags. And they can read through this stuff in greens and reds and yellows. So we don't show this to the patient before we issue the, or order the test, because again, this will either overwhelm them or underwhelm them. This test, even though they get the results directly, the results and reports are designed for all of our tests for real interpretation should be done with their physician. So you can see here it's got the categories, it's got the standard precautions, and it's the use with caution yellows and the reds. So if we scroll through this report, there's a red. The patient's not going to understand this report. All they're going to see is a red. And if they read through it, it's full of information that they're not going to understand. So that's why it's best to always tell them, we highly recommend that you go to your doctor and have these results interpreted. Sometimes they can go to their pharmacist and get it. These are the genes that they actually tested. And these are the alleles. So for you to try to explain what this report is about to somebody, you need to know what you're talking about first. So if you don't know what you're talking about, then please disregard telling them about this report. For everyone's knowledge, the gene is just that, the gene. The type, this is actually going to be the deviation, or down here is the SNP actually. The allele, what the allele is, it's usually a two-digit, two-number code. That is actually them being compared with a sample database of thousands of people, and each double letter or each letter means that it's linked to a certain number or percent of the people in that test group that have the same condition. Very complicated, very complex. That's the PGX test, the insurance-funded one. Now I'm going to show you another test. I'm going to show you our cannabis test. Here's the cannabis health report. Now this one's a little bit easier for the person to understand. It gives them an actual education on what DNA is, genealogy, or the genes, the SNPs, the alleles, how to read the report. It's got different categories. This one will actually make product recommendations, but more importantly, it gives them warnings of what to avoid. Terpenes, we could talk about CBD oil and cannabis at a later date, what these terpenes things are and what the ratios for THC to CBD should be, all these things. But what's exciting about this report, obviously, is it's going to give them product recommendations for certain scenarios, but if they go back to the most interesting part, again, is the raw data. This one's a little bit easier to understand than that PGX test because, like this gene of interest, the CNR1, and this SNP, just know this, these SNPs, you can Google these numbers on these reports on Google. It'll take you to the Genome Project, and you can actually see what this SNP is all about, what this allele is all about. But here's the association of interest for this particular SNP, which is based on this person's DNA makeup. It says they're slightly susceptible to Crohn's disease, and they have a small increased risk of high body mass index. And so that tells you here, cannabis products high in CBD tend to help with this intestinal inflammation. So as they go through, there's actually some cautions. This one here, because of this particular gene that they studied, this particular SNP and this category that they're in, there's reduced liver enzyme function, and so then it'll tell you to beware of potential drug interactions while consuming CBD. Again, even this one should be interpreted with a doctor's help, but it gives them a little bit more layman term stuff, okay? So this one here, this SNP, RS4680 in that AA allele group, look what it says. They're a worrier, and you can read all that. Adult ADHD. They recommend high CBD strains, and strains high in linalool as well as limonene may be especially beneficial. So at the beginning of the report, it'll actually tell them that these terpenes are what they should be looking for in their CBD formulas. High in limonene, high in beta-caryophyllene. Their secondary is pinene and linalool. Also says their THC to CBD ratio should be 2 to 1. Now you'll notice the cannabis is not just hemp, it's also marijuana, and so in the states that don't have restrictions and they have legal use, it will also list actual strains and products that are available to them in their local area that kind of meet the criteria. So a question is always brought up, well, why don't we get these tests in stores and on the shelves? Because the people that are selling CBD oil, for example, are selling who knows what. Excuse me. And so therefore, these test results may or may not point them towards the products they have on their shelves. That's why you'll find resistance. It's exciting to see what they need for the person, but the stores aren't really excited about it because they won't shop there anymore. All right. So that's the retail testing panels, how to interpret, how to recommend. That's the cannabis report. That's the PGX sample report. And so that concludes the new product and retail testing basic training.